Welcome back. We've all been through it. Puppy, new dog, whatever. You're trying to get them house trained. They've been house trained for a while, and then all of a sudden you notice he or she is having more accidents. But don't get frustrated because it could be a sign of an underlying medical condition.
That's right, and joining us is Dr. Brad McKenzie. He is a board-certified specialist at Affiliated Veterinary Specialist. It's so good to see you. Thanks for being here. You can't get too frustrated if it's, they can't help it.
Exactly. Thank you guys for having me.
Absolutely. So first of all, before we get into that underlying condition that might affect a lot of pets out there and the owners who are watching, talk a little bit about AVS and what you guys are all about.
So Affiliated Veterinary Specialists here in Jacksonville are board-certified surgeons, and we specialize in just surgery. But in our hospital, we're the only full-service specialty hospital in the city with surgery, internal medicine, dermatology, ophthalmology, and emergency critical care. So we work synergistically with your veterinarians on more challenging cases. And then available on the weekends when your dogs may eat something, like Curtis had to experience.
Yep, we dealt with that. And one of the things that we like to highlight and make sure people understand is the difference between AVS and your regular vet. You don't just, if something happens, don't just come to you guys with, hey, they're acting funny.
No, we basically work off of referrals only. And so see your primary veterinarian first because they can handle a lot of the diseases or illnesses that your pets have. But when things become a little bit more challenging with surgery, medicine, that's when they call on us.
So let's talk a little bit about the underlying condition that we hinted about at the top of the show. And you say don't get too mad. Because
no. And the big part of what I'm going to be talking about today is the older female dogs that over time they start to lose their urinary continence. And so owners will notice that when they get up from sleeping, there may be a puddle there, or as they're walking, they're dribbling a little bit. And so it's associated with a low hormone, and especially in these female dogs. A lot of them, about 97%, will respond to medical therapy. But there's that small number of dogs that don't respond or respond initially and then start to fail medical management. And so at that point, we can look at surgical options to help them regain their urinary continence.
Symptoms of this, obviously, I mean, you can see the puddle, that's one, but are there things that people should look for? I mean, obviously, you guys always say if you're seeing a difference in patterns of behavior.
Right, and a lot of dogs will start licking in the region, they'll get uncomfortable, they'll move around more, they'll be a little bit more agitated because they'll get some urine scalding or low-grade infection because of the urine just kind of leaking and pooling in that area. Because they're not actively urinating, it's just kind of dribbling.
And so talk about the surgical options. What can be done to help cure?
Well, yeah, in about 95% of the dogs, we do see marked improvement in their urinary continence. And what we have is what's called a hydrooccluder, where basically we implant a port, just like they do for chemotherapy, which is a venous access port. Connected to that is the hydrooccluder. The hydrooccluder goes around the urethra, and you can inject small amounts of saline into that to increase your urethral sphincter pressure to prevent them from leaking.
I get so fascinated when you guys get into the technical stuff here, and you got the.
I have one right here. It's very small.
Right
Yeah, we're going to pick it up.
What is that?
So here is the injection port, and then this is the hydrooccluder itself that goes around the urethra. And so you can inject small amounts of saline into the port, and that will increase the pressure. But the nice thing is about 50% of dogs, just by placing the hydrooccluder, that inflammation around the urethra will cause them to be continent. And so you don't even have to inject them, but it's a very painless injection, and you put small amounts of saline in there about every 2 weeks until you gain complete urinary continence. And again, it's been successful in 95% of dogs and a very low complication rate. And the incision's no bigger than that of when they were spayed.
And the technology and what you guys are using is so far, I mean, like that just shows it's so far different than your regular vet. This isn't your vaccines and things like that. You guys are doing this on a regular basis. If somebody thinks their dog has incontinence out there, first step though, they got to...
Yeah, I would start with your veterinarian, because it may be that they're dribbling or urinating inappropriately because they have a urinary infection or something like that. Or there could be metabolic diseases such as diabetes or Cushing's, where dogs drink a lot, therefore they must urinate a lot, so they become polyuric. And so that's not really associated with a urinary incontinence. There's a metabolic or could be an infectious cause underlying the
So the bottom line is to come find out what the issue is.
Yeah, always start with your regular veterinarian
first. And that would be my next question. Yeah, you guys are specialists, so not necessarily come to you first, but know that the referral is there.
Absolutely, absolutely. Right. We're there to support your veterinarian to make sure that your dog is treated with the best care possible.
Yeah.
And the locations for people around town?
So here in Jacksonville, we have a location off of Wells Road in Orange Park, as well as off of Beach and South Side is our Jacksonville office. We also have a center in Gainesville and one in Daytona.
Very good. Well, it's good to see you, Dr. McKenzie. Thank
It's good
you
seeing
so
you guys
much
again.
for being here.
Thank you for
appreciate
having
it.
me.
It's good seeing you here.
Yes, Curtis did
I
see
like
you
seeing-
in your
I like
office
seeing you when
setting.
you're here, not
Here or on the golf course.
Yes, on
Yeah.
the golf course here, fine.
As long as Brew's okay. Brew's much better after eating. What did
Yeah.
his dog eat?
I can't
It was like
a
a
sandwich
plastic,
wrapper.
a
Sandwich
sandwich.
wrapper.
Yeah,
Yeah.
sandwich.
Yeah.
It didn't go down so well.
No. Oh, it went down well. It didn't come out well.
No.
There you go.
That's all right. I had to go see
Good
that.
point.
Appreciate it, Doc.
Thank you very
Thanks
much.
for being here. We want to thank Affiliated Veterinary Specialists for making this segment possible. For more information, visit avspethospitals.com. You can also call the Jacksonville office at 904-646-1287 or call the Orange Park office at 904-278-0287.